Imagine waking up and seeing a giant lump growing on the back of your spine, because that's exactly what happened to me. I woke up to take a shower, and when I took my shirt off, I noticed that there is a weird lump on the back of my lower spine. Here are pictures of it. My brother took these pictures, but like any other person, I was like, oh my gosh, what if this is cancer? Like, I was scared. So I drove myself to the ER, waited at the ER, and then the ER doctor finally came to me. And I showed the ER doctor the lump on my spine, and the doctor's like, yeah, that's definitely abnormal. So they did an ultrasound. They took out the ultrasound machine and put it over the lump, and it looked like it was like fluid. The doctor said it looked like there was fluid building up on the back of my spine. I asked the doctor, like, is this gonna be cancer? The doctor's like, I can't say for sure. The doctor said there's no way to know for certain, but from the looks of it, it was not. Which is good, but it was still scary. And so the doctor said that I had to make an MRI appointment because they had to do a scan to see what was actually going on more underneath. So they gave me like a referral stuff. I had to go back home, and then I had to call my healthcare provider place. I had to set up the MRI appointment, but they said, sorry, we can't get you in until like 3 or 4 months in advance. You have to wait about 4 months to get your MRI scan, I'm sorry. And I'm like, okay, well, this is kind of like an emergency. There's a giant lump growing on my spine, and I'm kind of scared. I don't know if it's going to be cancer or something like life-threatening. I told them, is there any way we can get the MRI thing sooner? And they're like, no, sorry, you have to wait. And I'm like, okay, fine. So I made the appointment like months and months in advance. And I just keep thinking, if this was cancer or something really dangerous, and I was forced to wait months in advance, it could keep like progressing and getting worse. But I got really, really lucky because my healthcare provider called me on the phone. And they said, hey, someone canceled their MRI appointment at the last minute. Can you make this October 10th time? And I said, yes. This was in 2024, by the way. I said, yes, I can get my scan done October 10th, 2024. I think it was around 8 p.m., which I was like, interesting because it's not 9 to 5. It was at like later at night. But pretty cool. So I went to go do my MRI scan. I walked in. They told me how it goes, and they had to give me contrast. So I went in the MRI scan machine, and when I was waiting in there, they took me out and they said, we can't see your lump. And I'm like, what do you mean? Try going lower. So when they went lower, they said, yes, we can see your lump now, which is good. So I went in the MRI scan machine, went out, they put contrast inside of me, and then they put me back in the MRI machine with the contrast. I came out and they said I was done, and that they were gonna send the MRI results, scanning results to my provider, where they would look at it and like determine what to do from there. This is a picture of my MRI scan result. It's really cool because that's me. You can see my spinal cord, you can see like part of my tailbone, but you see that. So you see this, my MRI scan, and that little white lump with the small diamond-like arrow pointing to the white lump, that was the lump that was growing inside of my spine. So they sent it to my healthcare provider, and then I went back home, and then they called me. I went to them, and to schedule a surgical appointment. They wanted to surgically remove it. And so I said, great, yes, I want to get this surgically removed. And they said, great. So we split the whole surgery time. So now I have the time to get it surgically removed, which is good. So while I'm waiting for my surgery appointment, so the lump, here's the weird thing about the lump. It got bigger. As I was waiting for my surgical appointment, it got bigger and bigger and bigger and bigger. So I actually went back to the ER because the lump was like tripling in size, which is terrifying, right? I went to the doctor, ER doctor, and I said, my lump has tripled in size. Can you like look at it again? So they did the ultrasound again, and here's what the doctor said. The doctor said, it looks like that the fluid inside is increasing. So there's fluid building up inside. And I said, okay, well, I have surgery at this date. Is there anything I need to do before the surgery? They said there's nothing I could really do other than be careful. because the fluid was just like increasing in size. So I'm like, okay. So I went back, and literally, like, I think it was like 5 days before my like surgical appointment, the lump went flatter. Like, it was getting bigger and bigger and bigger, and then it got like more flat. So I went back to the ER again, and I told him, hey, my lump was tripling in size, but now it's getting like flatter. Now it's a lot more flat. And so they looked at it and they said that the fluid was leaking from my lump inside of my body. So the fluid was increasing and leaking out, increasing and leaking out, increasing and leaking out, doing that same pattern. So I'm like, okay. I went back home, and I waited as my lump grew in size, got smaller over and over again as that fluid increased and leaked out. Then finally it was time for my surgery. They were gonna have the PA, the physician assistant, take it out. And so the PA, the physician assistant, looked at my back, and know what he said? He said, there's nothing there. And I looked at him, and I said, what do you mean there's nothing there? I've been to the EI doctor. They said, yeah, there's a lump there that has fluid going in and out. I got an MRI scan, and the MRI scan clearly shows that lump there. And the PA was like, there's no lump there, that's just your bone. And so he made me get off that table, and he looked at me and said, you're just a young developing girl, so it's normal that your body is changing. And he told me to go home. I called my dad, and my dad's like, no, something is fishy about this. And then I asked the PA to look at my MRI scan, because I got that scan and it shows the lump. And he said, no, you're just a young growing girl. Go home. You're too young for this kind of stuff. He said I was too young for this kind of stuff to happen to me. And it was just my body changing. And I knew that it was not real, not true, but it felt kind of ageist because he said I was too young to have something like this happening to me. He said that word for word in front of me. And so my dad came, and so the PA made me leave out of the office, and then my dad came to my healthcare provider. And then my dad went up to the front desk and said that he wants to see the PA that denied me surgery. And for some reason, they wouldn't let us see him, but they did get the licensed physician. So the PA, the physician assistant, saw me. And so my dad was able to get the actual doctor, the licensed physician, to see me. So now we're having the actual licensed physician, the doctor, see me, not the PA. So another physician came to see me. He took one look at my back, and you know what the second physician said? He said, no, there is definitely something abnormal here. Let's remove it. And I told him, then why did the other PA say there was nothing there? He said, I have no idea, but there's definitely fluid there. And the licensed physician said he would do that surgery today and take it out if he wasn't so booked up. And so we requested that this licensed physician take it out instead. He said, yes, I will take it out for you. And because of that, we had to postpone my surgery, and we had to wait even longer to get it taken out. And so we postponed the surgery, and my dad actually threatened to sue my medical health care provider because they were clearly being ageist against me. Like, you don't tell someone, you're too young for this to be happening, so go home. He said that right to my face. And, it was upsetting. And the other physician clearly said, no, there's something abnormal, I'm gonna take it out. So he postponed the surgery so the other physician could take it out. Then when I came in from my surgery again to the other licensed physician that confirmed there was something there, he took a look at my MRI and said, yeah, there's definitely something weird there, let's take it out. And the good thing is I did not have to go down, I did not have to be put to sleep. That's actually one of my worst fears. I laid on the surgical table, and they put numbing in my back. I don't remember what it was called. I think it's the thing you do when you give birth. Epidural, I don't know. But he put a numbing thing in my back. He cut open my back, and he started ripping out my tissue in my back. So I didn't feel pain, but I did feel pressure. And they, during the surgery, they asked what my favorite music was, and they actually let me play my favorite music while they were yanking tissue out of my back. Eventually, after a while, he said I removed it all, and I'm like, are you for sure it's gone? He said, yes, I am certain it's gone. And here's the weird thing. During surgery, when he was ripping tissue out of my back, he was saying that it was really weird and that he's never seen anything like this throughout his whole doctor career. I'm like, okay, well that's reassuring. And so he took it out, put it in a cup, and then he sewed me back up. He said that I was getting dissolvable stitches, and because they were dissolvable, I didn't have to come back and get them removed. So he stitched me up and put this weird purple glue on my back. And then I got up. And then he said, do you want to see it? And I'm like, yeah. So he showed me a cup, and it was a huge thing of muscle sac tissue. Muscle tissue, in the cup. And holy crap, that came out of me. And this might gross you out because I'm about to show you actual pictures of my back after surgery. So if you're sensitive to that, you might want to skip. But, so these are 2 pictures of my back after surgery. You can see the stitches and the purple stuff in it that they used to sew me back up. I had to be very careful with the stitches. I couldn't be bending or lifting because you don't want to pop them, right? So I had to be very careful, but that was my back after surgery. So then I went home, and this was the waiting part. The waiting part was they were going to send the stuff they pulled out of my back, all of the weird tissue they yanked out of my back, they were going to send to the labs. And then they were going to determine, is this cancerous? Is this harmful? What exactly is this? What happened? So after a long time of waiting, I got my results. And it's very good news. The good news is that it was not cancer. Confirmed there was no cancer in there. All of the cells were healthy, they were normal, so it's definitely not cancerous. Knowing that it was not cancer had me relieved, but this is exactly what it was. I'm gonna have to pull up my diagnosis right now on my healthcare provider chart, but it says final pathological diagnosis. Soft tissue lower back. It said it's fibrosis connective tissue or fibroconnective tissue with granulation tissue and fibrosis. So what it looks like is that I had a lot of fibroconnective tissue building up in my lower spine. Here's what we think happened. I've worked 6 to 7 warehouse jobs. I've worked a lot of warehouse jobs for several years. And during those several years of working my warehouse jobs, I was lifting improperly. And I was getting repeated injury in my lower spine, which makes sense because when I'm lifting heavy boxes, the lump formed in the exact area where I was bending my spine and lifting up over and over and over again. And I got injury over and over and over again right there. And so my body made fibroconnective tissue in response to heal that injury. But my body overproduced healing tissue, meaning it made too much fibroconnective tissue, causing it to form into a small lump. That lump then started to collect fluid, natural fluid in my body, because that kind of lump formed like a small sac, which formed, allowing it to hold and collect fluid in there. And then when the fluid became too much, it kind of leaked a little bit, causing it to go back. So that's what it was. We know in the diagnosis it is confirmed to be fibroconnective tissue. It was just a huge lump of connective tissue in that area. That was all it was. And because fibroconnective tissue is often a response to injury, and the lump formed in the exact area I was lifting heavy boxes, we think it was just overproduction of healing fibrosis tissue in response to injury. So that's what it was. And that's my weird backstory. And if you think that's the only weird thing that happened to me, no, because I also grew 2 lumps on my head. But I'm going to say that for another time because it's already been a while. But I'm just relieved it was not harmful. It wasn't anything life-threatening. I'm just very thankful for that. So Thanks for listening to my rant, because I really feel like I had a rant about it. Thank you.